Welcome, everybody. I'm Brian,
And I'm George.
and our presentation today is on Module 3, Determining Competency, Scope of Practice, and Standards of Practice. These are basic addiction counseling desk references. Today, we will be covering determining competency, scopes of practice, and standards of practice for NADAC Module 3. And as an additional counseling professional, our goal is to provide ethical, safe, and effective care. This requires understanding what we are trained to do, respecting our professional limits, and continuously growing our knowledge and skills. Before we dive into the details, it's important to understand why these concepts, competence, scope of practice, and standards of practice, matter so much in addiction and counseling. They aren't just technical or legal terms. They form the ethical foundations of everything we do as professionals. Competency means having the knowledge and the ability to provide safe, effective, and culturally responsive care. It's not just about earning a credential, it's about maintaining the skill to apply our training appropriately, continuing our education, and being honest about what we can and cannot do. When we practice competency, we build trust with our clients, colleagues, and the community. Scope of practice sets our boundaries of work. It defines what we are legally authorized to do as a substance use disorder counselor. Respecting our scope isn't about limitations, it's about integrity and professionalism. And finally, standards of practice are the ethical and procedural guidelines that tell us how to do our work, how we can document, how we maintain confidentiality, how we respect client autonomy, and how we collaborate with other professionals. These standards ensure consistency and safe in client care. All three concepts, competency, scope, and standards, work together to protect both the counselor and the client. They help prevent harm, ensure accountability, and support quality care. When these areas are ignored, even with good intentions, it can lead to serious ethical violations, loss of licensure, or even harm to the very people we're trying to help. So as we go through this presentation, keep in mind that this isn't just about following the rules. It's about upholding the trust that clients place in us and honoring the profession of addiction counseling. Competency means what the skills, knowledge, and ethical foundations to provide safe care. This include knowledge of addiction, clinical skills like motivational interviewing, documentation, and relapse prevention, and culture and trauma awareness. Competence grows over time. We continue to train, seek supervision, and practice self-reflection. Now that defines competency. Let's look at what it actually looks like in the day-to-day practice. NADAC defines nine core skills that area of the addiction must master to ensure competent service delivery. These skill set reflect the counselor's ability to apply ethical procedures, principles, and evidence-based care in real-world settings. First, competency starts with accurate screening using valid and reliable tools like the audit, the DAS-10, TAPS, or GAIN to determine if a client is suitable for substance use treatment. Then we interpret the data to understand the client's needs and strength. Next, we determine appropriate placement, whether hospitalization, residential, intensive outpatient, or standard outpatient care, and select evidence-based modalities such as CBT, solution focus therapy, or mindfulness. Competence also includes creating individuals treatment plans that honor client input. Every client interaction must be documented accurately and confidentially. We're also responsible for coordinating with community resources, ensuring follow through on referrals, and supporting continuity of care when treatment ends. Finally, Competent counselors always adhere to laws and ethical standards. These nine skills are the foundation, safe, effective, and ethical addiction counseling practice. The scope of practice defines what we are legally allowed to do. For example, SUSCs can screen, educate, and provide evidence-based intervention, but cannot diagnose mental health disorders unless separately licensed. Respecting scope protects clients and prevent practicing outside legal boundaries. When clients present complex symptoms, we collaborate and refer appropriately.
Alrighty. So in addiction counseling, ethical dilemmas, they're inevitable. They don't necessarily mean that we've done something that's wrong. They just mean that we're navigating complex human situations where multiple values might collide. So, for example, we might face tension between client confidentiality and safety, or between supporting autonomy and enforcing program policy. So the key takeaway is that ethical decision making should never happen in isolation. Competent counselors, they consult. Consultation demonstrates responsibility, not weakness. It means taking the time to discuss the situation with the supervisor, documenting the discussion, and identifying what the next steps are that protect the client and uphold professional ethics. We also follow agency policy and state law. So let's say a client expresses suicidal thoughts. He would immediately assess for risk, consult our clinical supervisor, and then we would make the appropriate referral or report while documenting every action. Ethical consultation also extends to situations where our own values might conflict with the client's behavior or belief system. So whenever that happens, we seek supervision and then in order to explore our countertransference rather than acting impulsively or avoiding the issue. Uh, the NADAC Code of Ethics reminds us that consultation and supervision are the two strongest safeguards against ethical violations. It's not about knowing every answer. It's more about using every available resource to protect the client and to maintain professional integrity. So, competence, it doesn't stop at technical skills or theoretical knowledge. It extends to how we understand and respond to each client's cultural background and life experience. So, in substance use treatment, that means being culturally humble and then trauma informed. Culturally responsive counseling, it begins with self awareness. We must examine our own biases, privileges, and blind spots so that we don't unintentionally impose them on clients. So, no two recovery stories are the same. Culture influences how clients view addiction, shame, spirituality, family roles, and healing. Trauma informed practice reminds us that many clients entering treatment, they carry histories of abuse, they carry neglect, violence, systemic oppression. The guiding principles are safety, trust, collaboration, empowerment, and having cultural awareness. So that means avoiding re-traumatization and helping clients regain a sense of control over their treatment process. Being competent in this context is about curiosity and humility, not assuming we know what's best, but asking, what do you need to feel safe here? Or, how does your background shape the way that you see recovery? When we practice this mindset, we strengthen engagement, we reduce the dropout rates, and then we honor the dignity of every person that we serve. True professional competence includes cultural empathy and trauma sensitivity as essential, not being optional. So our final topic before we jump into our case study, it touches on the difference between competence and confidence, and what the importance is of recognizing when we might need support. Confidence is valuable, but overconfidence can become risky. Competence means having the humility to say, I'm not sure. I need to consult. I need to talk to my supervisor. And ethical counselors, they know that what their limits are, and they stay alert to signs of impairment. Things like burnout, compassion fatigue, unresolved grief, or even personal substance use history that may affect clinical judgment. Uh, the NADAC Code of Ethics specifically requires us to monitor our own wellness and for us to seek help when impairment could compromise care. So yeah, this is really important. It's not a weakness, it's professionalism. A burned out counselor can't provide effective empathetic treatment, and practicing self-care, supervision, professional boundaries, all of that protects our competence. So yeah, that might include attending therapy ourselves, debriefing tough cases, maintaining healthy routines, and taking time for recovery when we need it. As professionals, we model what we teach our clients. That recovery, that reflection, and accountability, those are lifelong processes. And competence it's only sustainable only when we care for ourselves the same way that we care for our clients. So you got to remember, knowing what you can do is skill, and then knowing when to step back, that's wisdom. So we're going to jump into the case study here. It's a fictional case, and it highlights the scope of practice and professional competence in addiction counseling. So yeah, meet Alyssa. She's a 24-year-old client in outpatient substance use disorder treatment for opioid use disorder. She has been consistently engaged in treatment for the past 3 weeks, and she's motivated to stay sober. During session today, she shares that she's been experiencing severe panic attacks, including racing heart, sweating, dizziness, and also overwhelming fear, especially at nighttime. And she tells us, I think I have an anxiety disorder. Can you diagnose me? And do you think I should get medication? Can you prescribe something to help me calm down? This scenario gives us a good opportunity to examine professional scope and then ethical practice. So before we break it down, let's think about this for a moment. As sub counselors, what is our role here? What falls within our scope and what doesn't? The first thing to recognize is the limit of our role. So unless we hold a separate mental health license or a medical credential, diagnosing psychiatric disorders and prescribing medication is completely outside of our scope as SUDCs. That being said, right, and this is really important, that doesn't mean that we simply say, I can't help you, right? So our role is still active. Competent and ethical practice means that we assess safety, provide support, and that we coordinate care, right? Ethical steps that we would take in this situation. So we would validate what her concerns are, and we would acknowledge her symptoms, and then we would explore how the panic attacks are affecting her functioning and her recovery. We would assess for immediate safety concerns, like does she have thoughts to harm herself, or if there's any relapse triggers going on. And then I think next we would explain, go over what our scope of practice is clearly and professionally. Say something like, I'm hearing that your anxiety feels really overwhelming. While I can't diagnose mental health disorders or prescribe you medication, I can help support you in exploring these symptoms. And then I can connect you with a provider who can evaluate anxiety and discuss whether medication would be helpful for you. And then we would collaborate. We wouldn't dismiss them. So that means consulting with the supervisor and then referring Alyssa to a licensed mental health provider or a medical professional and documenting the actions and the steps that we took. So yeah, this case, it teaches us that ethical practice, it's not about doing everything, right? It's about knowing what our professional boundaries are and ensuring the clients still receive the care that they need. So yeah, scope of practice, it's not a limitation, right? It's a protection for our clients and practitioners. So ultimately, competence means recognizing when someone is beyond our role, and then responding with professionalism, empathy, and then the appropriate referral. So we stay supportive, we don't diagnose or prescribe, we consult and refer, and we continue collaborating in recovery. So yeah, ethical addiction counseling requires competence, respecting scope, following standards, and then seeking support. Our goal is safe, empowering support for our clients. And that's it. Thank you guys for watching.
Thank you.